I have a slide that shows all the resources that are available for pediatric individuals with IDD, and it is a full slide. It goes from here to there. And then I show the next slide, which is centers of excellence for adults with IDD. It was crickets. It was like a blank. And that is really something that I emphasize. I hope that gets their attention, but to know that there are a lot of resources early on, but then there aren't any afterwards, and you have to be that resource.
I can certainly say that I'm aging, and therefore what's normal or not. In people with developmental disabilities, aging to them may be looked at in a whole different way, or not even appreciated that they're aging abnormally, because of the fact that it might happen so slowly or subtly that it might be not really appreciated that they're getting older and there's a condition that they have, which might be a disease of some sort, but it may be not recognized or it can be blamed on their underlying developmental disability. Oh, someone with CP, someone with autism is now not able to what they used to do, and that's called diagnostic overshadow. It's the concept of almost like a bias or misperception that the blame of their changes is all related to underlying developmental disability.
So programs like this will help engage a wider audience so that they have, even if they don't fully understand what needs to be done or how to do it, they at least have that awareness that it's different and there are nuances. And then if they have that client in the future, they can dig more into it.
And they might need more support. So it's not only for the individual that's aging, it's for their family members and their care supports that need to be able to prepare. What do they need to do to ensure that they can maintain that person's level of ability to stay functional and happy in their environment?
So how my son is treated, how my son is included or not included or treated poorly impacts all of us. It impacts his siblings, it impacts his parents, it impacts our mental health, and my bucket is only so full. And so when I'm advocating and trying to get him things, or we have to split up as a family, that impacts us.
There are a lot of resources early on, but then there aren't any afterwards, and you have to be that resource. And I think that the more health professionals that are aware and comfortable and able, that's what we have to ensure with any educational processes, that we're maintaining a level of expertise in caring for adults with developmental disabilities as well as pediatric patients.
When we did the presentation, we related it to a case. So for example, the presenter would say, I have this patient who's 65 years old and he's having this, that, and that, the other problem. And then the presenter would go into their presentation, whether it was on seizures or whatever needed to be resolved, and then relate it back and ask the audience, so in regards to so-and-so who's 65 years old, what would you do? And we got a lot of feedback from the participants. And that makes it real, because what's going to happen, having done this for so many agencies and in so many different places in different states, they're going to remember that case. And that's going to help them relate it to what they do in their own practice. So I think that was really key, having that piece, and it encouraged a lot of discussion.
I think that a lot, the topics that were covered were always engaging and represented all different disciplines, from the legal aspects, from the social aspects. Certainly behavioral health was well represented and quite necessary.
I expect people to just have an open mind and meet me in the middle, because there's no way that they're going to have all the answers and I don't have all the answers, right? It's a team effort. We're all on a team. So having people understand, I think that the expectation is not that I just want you to give me all the answers. It's let's have a dialogue about this and figure out the best ways to support him.